Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Welcome everyone to today's show. And today's show is going to be very important because we are going to talk about the vaccinations and the coronavirus. And today, joining us is a very special guest from United States of America, Dr. Jeffrey Barke. Welcome to the show, Doctor.
Thank you for having me. Very nice to be here.
Thank you for joining, Doctor. So today we will be talking about the coronavirus, and because it's already been 1 year now, so we see the vaccinations rolling out. So before we come to the vaccinations, I just wanted to give an audience a gist about what do you think this coronavirus pandemic is all about? Is it a real medical pandemic, or what do you think about it?
I think it's important not to minimize the pain and suffering that's been going on with this virus. It's real. There's been a lot of deaths. And if you're in a high risk group, it's important to use great caution. That being said, it's not the coronavirus that has devastated the United States and your country and the world. It's not the coronavirus that has shut down the economies of the world. It's not the coronavirus that has shut down all our schools across the United States and across the world. It's governments that have done that. And I think the reaction to coronavirus, the way in which many governments have responded to it, has been the cause of the pain and suffering and the misery. Now, it's really important that that we don't minimize the risk to those that are at high risk from this virus. And we know quite clearly who's at high risk. If you look at the CDC, Centers for Disease Control in the United States, if you look at the statistics that they put out, we know that about 80% of all deaths from coronavirus have been in people that are 65 years old or over. And we know that of those people that have died, 94% of them have significant underlying illness that has contributed to their mortality. So when I first heard that, it made sense to me that what's important is to protect those that are most vulnerable, meaning if you have an underlying condition, that's what should be addressed. If you're in an older age group and at high risk, we need to be very, very careful with you. But for the vast majority of the population, those that are young, those that are healthy, this is not a virus that should be feared, that should ruin our life, that should shut down the economy, and should shut down all our schools. In fact, just the opposite. And unfortunately, we have not taken, in my opinion, the appropriate approach to this virus.
Right. Doctor, you mentioned about not taking the appropriate approach to this virus. So what exactly do you mean that it's not an appropriate approach? Because we see the mandates like lockdowns, masks, sanitizers, so much being promoted in the media, the celebrities are doing it. So is it not appropriate? And if not, then how?
So, I think the appropriate approach should be similar to how we've responded to other viral pandemics. So we've had several prominent epidemiologists and physicians that have come out and supported and sponsored a concept called the Great Barrington Declaration. Great Barrington, that name comes from a town in Massachusetts in the United States. And Dr. Jay Bhattacharya was the lead author of this. And his idea and others were simply we should use what he described as focused protection, meaning we should focus our protection on those that we know are most vulnerable. Never in the history of this country, and certainly of the world, have we quarantined healthy people. We haven't done that before, except now. So Dr. Bhattacharya and others have suggested that what we should do is focus our attention on those that are most vulnerable. And we know who those people are. And for the rest of us that are young and healthy, we should go about our lives with only minimal interventions. And the idea being, in addition to the vaccine that has come on the market, we should allow natural immunity to create a level of herd immunity. That's how we've done it with every other infection and illness and pandemic, if you will. So I agree with Dr. Bhattacharya that would have been the correct approach, not the approach that we've taken, where we've put fear into the people of the world in the United States, where we've closed down the economy without any idea and without any thought of what are the consequences of doing that. And what I mean by that, in the United States, we've had unemployment levels at the peak of the pandemic that reached as high as it ever has since the Great Depression here in the United States. We've seen the highest level of mental illness and teen suicide in this country that we've ever seen in our country's history. As a matter of fact, we've had more teens die from suicide than we have from the coronavirus itself. And that's all a result of how we've responded to this virus, not the virus itself. So I think we've made a big mistake, and 5 or 10 or 15 years from now, when we look back, we'll realize that we should never have acted the way we have. And the way we have acted has caused more harm than the virus itself has caused, unfortunately.
Right, Doctor, you mentioned that the mandates which are being imposed are much more deadlier than the virus itself. So when we talk about the modern medicine, we see evidence-based medicine. So WHO and all the governments, they must be acting on evidence. For example, if they must be having some supporting evidence behind the mask mandates or behind the lockdowns. Is there any scientific evidence to prove that these mandates work to actually stop the transmission of a virus and make people healthier?
It's a good question. So let's not take my personal opinion. Let's take the words of the experts themselves when they were asked those exact questions. So Dr. Fauci has become somewhat of a legend here in the United States and around the world, and unfortunately, too many people are listening to a bureaucrat that has not been elected by a single person here in the United States, but yet he's rose to this level of power and prominence, in my opinion, that he should never have had. So back in March of 2020, Dr. Fauci said, and I'm quoting now, these are his words, not mine, "People should not be walking around with masks. It's not providing the perfect protection that people think it is." He goes on to say, "There are unintended consequences as people keep fiddling with their masks, keep touching their face, which may actually increase the risk." So that was Dr. Fauci himself. Then the United States Surgeon General, Dr. Jerome Adams, said, "Stop buying masks. They are not effective at preventing the general public from catching coronavirus." Then one of the leaders of the CDC, Centers for Disease Control, here in the United States said the following, and I'm quoting, not my words, but her words: "We don't routinely recommend the use of face masks by the public to prevent respiratory illness. And we certainly are not recommending that at this time for this new virus." The CDC director himself, Dr. Robert Redfield, who has now come out and has been quite critical of our response to this virus, said, and I'm quoting, "Instead of wearing a mask, the general public should be vigilant to the symptoms and signs of coronavirus. There is no role for masks in the general community." These are his words, not mine. And then the World Health Organization, and by the way, the World Health Organization, I give very little credibility to. In my opinion, they are simply a propaganda wing of the Chinese Communist Party. You may remember when this virus first came upon society, the World Health Organization praised the Chinese Communist Party and the Chinese government as doing a wonderful job of transparency. They also echoed the Communist Party's line that this virus was not dangerous, that we had nothing to worry about, that it couldn't be transmitted person to person. So I give almost no credibility to the World Health Organization. And I believe President Trump at the time did the right thing by defunding the World Health Organization from the standpoint of the United States' role. So the World Health Organization said the following as it related to masks: "The use of masks is insufficient to provide adequate level of protection, and other equally relevant measures should be adopted." And then most importantly, the most prestigious medical journal in the United States, the New England Journal of Medicine, had a very long article by some esteemed physicians, and they said the following, and I'm quoting, "We know that wearing masks outside the healthcare facilities, meaning outside of a hospital, offers little, if any, protection from infection. They go on to say, and here's my favorite line, expanded masking protocols' greatest contribution may be to reduce the transmission of anxiety. So we've known for years and years and decades that wearing a mask, and in particular homemade masks and these thin surgical masks, offer little, if any, protection against a viral illness. Yet here we are, and on, it's going to be a beautiful day today in Southern California, as it is almost every day, in the 70s, and I'll be out walking around, and you'll see people by themselves walking with a mask on, walking their dog with a mask on, or my favorite is driving in a car by themselves with a mask on. We have so been indoctrinated with fear that we must comply with government mandates, that people are doing things that are quite ridiculous and really have no role in public health. But somehow this virus of fear has taken over not just the United States, but the world. And it's very, very sad to me as people all over the world, from Canada and the UK and throughout Europe and Asia, look to what's supposed to be the bastion of freedom, the United States of America, and we are behaving like a tyrannical country in the way in which we're behaving and the way in which we're following, of all things, government edicts. The United States was born with the idea that it was the people that ran our country, that the government was supposed to be representative of the people. But the opposite is happening now, and it's very sad to me. We are complying with government mandates and edicts as if we lived in the Chinese Communist Party's country, or we lived in Cuba or Venezuela or somewhere where we're so fearful of government action that we must comply to their orders. And many of the things that we're doing don't make scientific sense to me, and it's very sad that we're behaving this way.
Right. Doctor, you mentioned about measures and mandates not being science-based, not being evidence-based. So before we come to what these mandates are all about, just a quick question is, you mentioned that the CDC survival rate is the virus is more deadly for the aged ones, and because it's CDC data mentions that. So my question was, if the virus is not so deadly for the younger age groups, we see skyrocketing death rates in United States of America of COVID-19. So why would the death rate be so high?
Well, the death rate is not high in young people. If you look at the CDC's own data, for people that are less than 20 years old, the survivability of coronavirus is 99.997%. Just to wrap your hands around that number, children are at higher risk of seasonal influenza than they are of coronavirus. So depending on what age you look at, what age bracket you look at, the risk is greatest in older people. So even if you look at people that are older than 70 years old, the survivability is 94.6%. So I'm not saying for a moment that we should not take this virus seriously. We should. But the folks that should be taking this virus seriously, and our efforts of how we should be behaving, is a focus on those that are at highest risk. And those are older people and folks with very significant underlying health conditions. If you're less than 70 years old, you have a greater than 99% survival rate from this virus. So take it seriously, but also we need to take into perspective who's at highest risk. And unfortunately, what we're not doing is we're not putting forward information about how to treat this virus in the early mild stages. Too often, even in the United States, when somebody gets ill, most doctors are simply telling that person to stay at home, to isolate. And if you get sick enough, you show up to the hospital. I think that's entirely the wrong approach. Imagine this. Imagine a woman who's diagnosed with breast cancer, and we tell them, sorry that you have breast cancer. Give me a call if this cancer should get worse and spread. We would never do that, and you'd lose your license to practice medicine if you did that. For every medical illness I can think of, early intervention in the earliest stages of that illness is critical to improved outcome. Yet in coronavirus, we are criticized, many of us, when we want to intervene early. And there's a whole array of tools we have now to intervene. Things like hydroxychloroquine, ivermectin, inhaled budesonide. We now have available outpatient use of monoclonal antibodies. Even the older generation antidepressant medication, Luvox, has been repurposed and shows some benefit in reducing inflammation. And then, of course, we have a multitude of supplements such as zinc and the importance of vitamin D3 and so forth that play a benefit. But you'll never hear this on mainstream media sources, how people can treat this early and what interventions are available. And why is that is speculation. But I can't help not believe that there is some financial incentives to downplay early intervention with inexpensive, cheap medications and to play up the much more expensive interventions that are available primarily in the hospital. I mean, I'm aware there are some countries where hydroxychloroquine is available over the counter. I'm aware in India, for example, you can actually buy a COVID pack over the counter that includes things like hydroxychloroquine and zinc. Yet in the United States, it requires a prescription. And when I prescribe hydroxychloroquine, it is not uncommon for that prescription to be challenged by a pharmacist who doesn't think that hydroxychloroquine should be used for coronavirus. And it's really too bad. And that level of pushback from pharmacies is preventing a lot of physicians from wanting to even get involved in the early treatment for coronavirus. So it makes me very sad to see people unnecessarily suffer. I've treated literally hundreds and hundreds of patients with COVID-19, and I've been very successful with some of these interventions that I've described to you. I've tried to teach other physicians how to do this. There's an organization that I'm part of called America's Frontline Doctors, and there's a group of doctors that are really pushing back against some of these tyrannical mandates. We really look at ourselves now as the new ACLU, American Civil Liberties Union, the new civil rights organization, pushing back against some of these infringements and tyrannical mandates. So we're trying to help people that are being canceled, physicians that are having their license threatened because they want to intervene early. So I'm proud to be part of that organization that I think is making a difference in the treatment of coronavirus.
Thank you, doctor, for fighting for freedom and rights and health. I would like to share one of my experiences. So when this pandemic started, so I'm in Canada, so I contacted my doctors, my circle in India. So they formed a group, a network of influenza care experts, which about, I think, some medical doctors, some natural healers, some nutrition experts, and they made a group of about 100 people. And then what they did was they consulted people, and through that, in about 6 months, they were able to reach about 50,000 patients of coronavirus. And what they did was it was a diet protocol without using any drug. They just gave diet that boosted their immune system through vitamin C in natural form. So what happened was all those who took this early intervention, for example, with the first symptom of the coronavirus, they started taking this diet protocol. All of them were alive. None of them died. Everyone was good. And when we shared this information out in the public, in YouTube, on Facebook, our channels were deleted, our videos were pulled off, we were censored from the channel. So this is happening. The cures are being suppressed, and nobody is talking about the immunity, and also HCQ and other treatments which are available have been suppressed, as you mentioned, doctor. So just a quick question, doctor. Is there anything about the death certificate guidelines that have been changed, which are increasing the death rate?
Yeah, death certificates in the United States are very complicated, and I have filled these out in my career, and typically there's a line that asks for the primary cause of death, and then lines after it that ask for contributing factors as well. So there are a number of cases that I have seen personally where patients died that had nothing to do with coronavirus. Yet coronavirus was listed, or COVID-19 was listed as a cause of death. During the early stages of coronavirus, and even to this day, I've been writing essays and putting them out on social media for people to read. I have a website, rx4liberty.com, rx4liberty.com, where you can read those. And I published a book about these, and there's a essay, one of my favorite essays, called She Died Alone. And the book is Coronavirus, COVID-19, A Physician's Take on the Exaggerated Fear. And on my website, RX for Liberty, there's links to it. I try these days not to buy things on Amazon because I don't like their policy of shutting down opinions that they don't agree with. So there's a link on my website, RX for Liberty, directly to my publisher, so you can bypass Amazon. So this essay, She Died Alone, is about a nursing home patient that was doing just fine, and it was a wonderful nursing home with very loving people that cared for their residents. Shortly after coronavirus hit, family was no longer allowed to visit because of all the precautions that they put in place. As a result of that withdrawing from familial contact, her condition worsened, and she soon went into hospice care. She went into hospice care because she had congestive heart failure and pulmonary disease and so forth. And she passed a couple months after going on to hospice. As part of the protocol of the medical examiner and the nursing home, an autopsy and some testing was done, and it was discovered that she had coronavirus antibodies. And sure enough, this woman's death certificate represented that she died of coronavirus, even though everyone knew, her family, me included, that her death had nothing to do with coronavirus. Yet it was listed on her death certificate. So I've seen repeated examples of this over and over again. We've never designated that on a death certificate the way we do now. So if you check into a hospital, for example, for nothing to do with coronavirus, you go in for a routine procedure. Let's say you need a hernia surgery. You're automatically tested for coronavirus. And if you test positive for coronavirus, your hospitalization is then listed as a coronavirus hospitalization. And if something should happen, not from a hernia surgery, but for some other reason that you're in the hospital, that you should pass away during your hospitalization, if you've tested positive for coronavirus, coronavirus is listed as a cause of death. And so I believe, at least in the United States, we're now north of 500,000 deaths associated with coronavirus. Unfortunately, I believe a lot of those deaths are not from coronavirus, but are people that have died with coronavirus. And the media loves this. They love being able to scare people because with fear comes compliance. And again, I want to emphasize, I'm not saying this virus isn't dangerous and worthy of our careful attention. I just think the fear of coronavirus has been so exaggerated, and exaggerated in some situations to ensure compliance with government mandates. And now as people push back against those mandates, we're really seeing a division in our country and around the world of people pushing back against a tyrannical government mandates and interventions that just aren't needed, unfortunately. And I'm proud of those folks that are pushing back and are saying, no, we're not going to do this anymore. We're not going to live our lives in fear of a virus that has a very high survival rate, that we know affects a very small minority of our population, the most vulnerable. And we need to stop behaving as if this is the plague or something so horrible that we should all lock down in our homes. So I think it's time for normalcy to infect our world again. And it's time for citizens that have had enough of government mandates and tyranny to push back and say, I'm no longer going to be part of this. I'm going to start living my life normal again, while protecting those that are most vulnerable.
Doctor, you mentioned about the unscientific mandates and the collateral damage, and besides that, we talked about the death certificates being somewhat, we can say, somewhat manipulated, and because people are not really dying from coronavirus, but with coronavirus. So Why is this happening? Why would doctors write coronavirus as the cause of death, and why these tyrannical mandates are being pushed? What's the agenda behind this?
I don't know, so I'm speculating. But in the United States, the insurance payers, and in particular Medicare, decided to increase the reimbursement when hospitals were taking care of COVID-19 patients. And it made some sense because initially we were very worried that hospitals were going to be overwhelmed with COVID-19. So they wanted to compensate hospitals that had basically shut down their facilities to all elective procedures and were focusing on just coronavirus patients. So they increased the reimbursement. And it's just natural human nature to lean in the direction of reimbursement and financial reward. So it was very easy when you had a patient that maybe didn't have laboratory confirmed COVID-19 to just simply check the box of patients that passed away from respiratory illness to include coronavirus because they knew that they were getting reimbursed more for a coronavirus patient than for just a plain pneumonia patient. The CDC also changed the way they tracked illness. It used to be that they would have separate categories for pneumonia and for influenza. During coronavirus, they have now grouped diseases into one bucket of pneumonia, influenza, and coronavirus, PIC. And they've never done that before, but this was, I think it was June of 2020, where they switched the way where they grouped illness. So you could no longer separate somebody who had pneumonia versus influenza versus coronavirus. They were all grouped together in one. And, interestingly enough, that we've seen an almost complete elimination of influenza. Normally, in any particular year in the United States, you'll have somewhere between 20,000, maybe at the lowest, up to 60,000 deaths associated with influenza. And influenza is counted very differently than we have counted coronavirus. With influenza, of course, if somebody dies of some unrelated cause and they happen to have influenza, we would never check the box that they died from influenza, but that's exactly what we're doing with COVID-19. So now we see almost no influenza around, and people are wondering, how is it that influenza has simply disappeared? Has coronavirus taken over influenza? Are some of the coronavirus deaths actually underlying influenza? I think that's likely the case. Or is there something else going on? And I don't know what the answer is. One thought is when our body is infected by a virus, it often is immune from a secondary infection from another virus. So it could be if you're infected with coronavirus, you're much less susceptible to an infection with influenza. Of course, I've also heard, and I don't think this is the case, that the same mitigation efforts that are being put into place to stop coronavirus are effective for influenza, meaning social distancing and mask wearing is effective during influenza season. Yet we've never seen this in the past. We've never mandated that people wear masks. We've never shut down schools during influenza season. And the influenza virus and the coronavirus are very similar in size. So it doesn't make any sense that a mask would stop influenza but not stop coronavirus. So that doesn't make any sense. So I think it has more to do with the way in which we're identifying and counting, and the possibility that getting double infected with coronavirus and influenza may not occur, and a coronavirus infection may in fact prevent some level of infection from influenza. But I don't nobody actually knows what the actual reason is. You're hearing from the media the narrative that again, that they want you to comply with masks and so forth. So the narrative is, well, of course there's no influenza because everybody's wearing a mask, and masks are protective against influenza. We've studied this before, influenza, common cold, and other viral illnesses. And we've known for decades that masks play very little role in protection against viral illnesses. The question I always get is, okay, Dr. Barke, if masks don't help, why do surgeons in the operating theater wear a mask? And, I'm not a surgeon, but as a resident, of course, I spent time in the various surgical fields, and I spent a lot of time in the operating room during medical school and residency training. And of course, it's true, we all wear masks during an operation. But the reason why we wear masks is different than you might think. It's not to prevent the spread of viral illnesses. It's because when you're in an operating room, there's multiple doctors and nurses, anesthesiologists, and so forth. And it's critical that we all communicate and talk. And when you talk, there's a natural tendency to spit a little. You have a little spittle that comes out of your mouth. And when you're standing over a patient, you don't want that to end up in an open wound. In addition, when you're operating, there's often saline rinse. You use a sterile saline solution to rinse out the wound when you're operating. And when you do that, there's spray and splatter. And so you don't want the patient's open wound to splatter in your face, in your eyes, and in your mouth. So those are the reasons primarily that we wear a mask. It's not unusual during a very long operation that a surgeon will step away from the surgical table, have their mask changed because it has junk all over it, and put on a fresh mask. So the prevention and spread of viral illnesses is not the reason why a surgeon wears a mask. In the hospital, if a doctor or nurse is taking care of an infected patient, a COVID patient, let's say in the ICU, they don't wear a surgical mask. They wear a custom fitted N95 mask. In my hospital, a couple times a year, you can make an appointment to go get fitted for an N95 mask. It's usually a nurse that will have you try on a variety of sizes to make sure it fits properly. They'll also teach you the proper technique to put a mask on and to take a mask off. So when a doctor or nurse goes into an intensive care unit to take care of a COVID patient, not only will they have a properly fitted N95 mask on, they'll also have eye protection, glasses, they'll have a gown on, they'll have gloves on, something that fits over their head as well. They'll spend some time in the ICU and then leave. When they leave the ICU, they then take off all the protective gear. And what do they do with that N95 mask? They don't put it around their rear view mirror. They don't put it around their forearm for use later. They put it into a hazardous waste container so it can be disposed of properly. It's really hilarious and sad when I see somebody with a mask, around their forearm or hanging over their rear view mirror and being reused. If you're going to use a mask and for it to have any level of protection, that mask must be worn for a short period of time and then disposed of properly. And the next time you need a mask, you get a brand new clean mask and you put that mask on. And that's never happening. You see people running into the market with a mask. They leave the market, they take their mask off, they put it in their pocket or over their arm, only to be used later that day again. And not only is that not helpful for protection against a viral illness or for any illness, it potentially can be harmful. Because as soon as you take that mask off and put it in your pocket, you've now contaminated that mask. Anytime you wear a mask for more than just a few minutes, you've also now have increased moisture inside that mask. Whatever is inside your mouth and nose is now inside the mask and is being concentrated. So wearing a used mask over and over again can actually be more harmful than helpful in preventing any disease or respiratory illness. So I don't recommend it. If you are one of those people that find it necessary to wear a mask, then have a whole stack of sterile masks that you can use and throw away and replace frequently for it to have any hope of offering even a small amount of protection. But the way that most people are wearing masks makes no sense at all, and in fact can be more harmful than good.
Right, doctor, you talked about the mask, and my question is particularly about the children. Do you think this mask is causing greater damage to the children? Because for the youngers and the elder ones, we can still manage with it. But the children who are just came into society and they're going to the schools, and also we'll talk about the schools getting closed. So, what do you think about it?
I think closing schools have been one of the gravest mistakes we've made in this country, and the science supports that. So we know that children are at very, very low risk of this virus. In the United States, kindergarten through 12th grade, you're less than 20 years old. And we know the survivability of this virus when you're less than 20 is 99.997%. COVID has a higher survival rate than seasonal influenza, but we've never closed the schools during influenza season. And for goodness sake, we've never required masking of children. I truly believe what my friend Mark McDonald, who's a child and adolescent psychiatrist, says, that forcing children to wear a mask is a form of child abuse. Not only is it ineffective, I mean, have you ever seen a 6 or 7 or 8-year-old wear a mask? They don't know how to wear a mask. They're not compliant with the mask. They're touching it. They're pulling it on and off. They're sharing masks with their friends to see who's got the coolest homemade mask. In addition to being ineffective against the transmission of a viral illness, and more importantly, it creates a level of mental impairment in these children. We're human beings, and God designed us to communicate through facial expression, through eye contact, and looking at each other's face and mouth when we communicate. To take that away from a small child, that they can't communicate with their teacher, an important adult in their life who they form a long-lasting bond with. When the teacher and child both have a mask on, it creates a level of dystopia that is harmful to that child. Learning disabilities skyrocket. Anxiety and depression skyrocket. I had a child in my office, and I wrote an essay on this. I think the essay is titled, "It's Just a Mask." And it was I think an 8 or 9-year-old who came in, who they had sprained their ankle playing basketball at the park over the weekend, and they came in for me to look at their ankle. And the child sat on the exam table with a mask on, and the father in the chair next door without a mask on, interestingly. And when I walked into the exam room, I didn't have a mask on. And I told the child, it's okay, you can take the mask off. There's no need for you to wear the mask. And the child looked over at the father, and the father shook his head and said, "It's okay, you can take it off." And they looked back and forth at the father and at me. And the child said, "No, it's okay. I'm used to the mask. I'm more comfortable with the mask. I'm just going to leave it on." And it made me so sad to hear that now this child is fearful to take the mask on. And now his normal is to wear a mask. And it was one of these homemade masks with a design on it, completely useless against any respiratory illness, arguably harmful because it reduces oxygenation and the buildup of moisture and bacteria and whatever else is in that child's mouth and nose is building up on the inside of that mask. And it just made me so sad. There is absolutely no reason for a child to be wearing a mask. And certainly there's no reason for a school to be shut down. We know that children do great with coronavirus. I've treated many. They usually have either no symptoms or their symptoms are very mild, like a common cold. We also know that there is little or no evidence that asymptomatic children without symptoms of COVID-19 can spread this to at-risk adults like teachers. We know that teachers, in fact, are at greatest risk, not in the classroom, but in the teacher's lounge or lunchroom. So teachers are at lowest risk when they're in the classroom with teachers, classroom with children, and at highest risk when they're in the lunchroom with fellow teachers. So we are doing what's not best for children, and we're looking through the lens of, in the United States, through teachers' unions and teachers, not children. And unfortunately, we're harming our kids as they've lost almost a year and a half of education. And as a result of children being home, a parent has to be home now to monitor them, and it's been disruptive to businesses as well. So we've made a huge mistake, in my opinion, in closing down our schools.
Doctor, my question was now, what should the parents do? Because parents have to do something about it.
I think parents should push back and say, no, I'm not gonna do this. And if their local school refuses to open and refuses to allow kids not to wear masks, then parents have to group together and find alternatives. In the United States, we have a robust homeschool movement where a lot of people are pulling their children out of government-run public schools and putting them in homeschools. Last year, I started a new charter school. It's a free public charter school called Orange County Classical Academy. We use Hillsdale Colleges. That's a liberal arts college in Michigan in the United States, very well known. We use their curriculum, and we've been open throughout this entire pandemic. We've never shut down. We've had 0 cases of COVID-19 in our school. And we just expanded our school by 1 grade. So we had room for 36 kids, and we had over 500 people in a lottery to take those 36 spots. So we're working hard to try to open up another school to accommodate people that want something different than the indoctrination that occurs at many of the traditional government public schools in our country. So I'm working hard to do that, what I can in Southern California. And I hope other parents push back and look for alternatives, whether it's a charter school or a private school or a homeschool movement in your city. I think that's an alternative. And it's the silver lining, really, as to what's happened in our school system, because our school systems have really become, in the United States, government indoctrination centers, teaching kids things that have nothing to do with the basics of education. Too many of our kids in the United States are falling way behind. They can't read, write, or do math at grade level, yet they are being woke to the political correctness of our day. And that's not really and shouldn't be the role of schools. So fortunately, the silver lining is more parents are waking up to what's going on in the classroom as they're able to view through Zoom some of the lessons from their teachers. And they're astonished by what they're seeing, and they're saying, no, thank you. I'm going to pull my kid out of school, teach them myself, or have them join a homeschool network so they can actually learn how to read and write and do math and not just be indoctrinated with political correctness.
Thank you, Doctor. I'm sure parents must look into it, that they don't go through indoctrination but get real skills, and they must push back. So, Doctor, now we talk about the vaccinations, because that's the point
Sure.
of focus now, and that's being rolled out now. People are taking vaccines, and I got messages every day that should I take the vaccine or not. What do you think about this vaccine, Doctor?
I wrote an essay in my book, and you can find that again, RX for Liberty. There's a link to it, and I think the vaccine essay is up there as a standalone essay as well. The Moderna and the Pfizer vaccine, actually all the vaccines that are on the market, are being used under emergency use authorization in the United States, and they're all investigational vaccines. This is not my words and my opinion. When Pfizer and Moderna presented their white paper to the FDA here in the United States to get approval, the executive summary of the white paper listed clearly that this is an investigational vaccine and that they're asking for approval under emergency use authorization. These vaccines are not approved by our FDA. They're used under emergency use authorization. That's very different than the approval process. Normally, when a new vaccine comes to market, it takes about a 5-year period of time. Extensive studies are done on animal models first before trials are done on humans. The FDA gave these vaccine companies a waiver to bypass much of the animal model studies to come directly to market and to do these studies directly on humans. So with Moderna and Pfizer, these are brand new technologies for vaccines, messenger RNA technology. So we've never done that before in a vaccine. Both the combination of an investigational product being used under emergency use authorization, using a new technique that hasn't been used before in a vaccination. We've never done that before. So that in and of itself should make people use great caution and to investigate themselves, understand what the potential benefits are and what the risks are. I'm not an anti-vaxxer, but I am for informed consent for vaccinations. And that's really what I want from a patient standpoint.
Right, doctor, you mentioned about the risk and benefits analysis. In the benefits, what I have understood till now is the vaccine would just stop one positive test and a symptom, and there's nothing more about it. But if we talk about the potential risk, we have been listening so many risks by now. If we don't listen to the mainstream and we listen to doctors who have been speaking up, we see a lot of potential side effects. Could you tell us what could be the potential side effects of it?
Oh, absolutely. In the United States, there's a website called VAERS, VAERS. It stands for Vaccine Adverse Event Reporting System. That's a website, it's a government website. It's run by the CDC and the FDA. This website came to be, I think, in the late 1980s, about the same time that all vaccine companies were given immunity from liability in the United States. Yes, that's true. So vaccine companies are immune from all liability against their products that they manufacture in the United States. This came about in the 1980s. So this vaccine adverse event reporting system is a site anybody can log into. It's a little bit difficult to navigate, and I think by design. So it's hard
Yeah.
to see the statistics. But there are folks like Bobby Kennedy Jr., Children's Health Defense, and he breaks it down on a weekly basis to put a table together about the side effects and the reported illnesses that occur as a result of the vaccine. So far we've seen close to 2,500 deaths associated with the vaccines. Now these are correlation, not causation, but nonetheless, they are reported, and thousands of hospitalizations and adverse events that are being reported. It's estimated that this website only captures somewhere between 1 and 10% of all adverse events. And the reason why is who's ever listening now is probably saying, what's that website again? I've never heard about it. And most people, even in the United States, have never heard about this VAERS website. Physicians are supposed to report adverse events. Patients can self-report as well. But most doctors I talk to have never heard about this website, and most patients don't even know that it exists. So only a small percentage of the actual adverse events are reported to this website. And so, again, I'm not suggesting that people should absolutely not get this vaccination. And I think if you're in a very, very high risk group, it's worth your consideration, but only after you yourself are informed about the benefits and the risks and you make a decision. Right now, we're seeing propaganda. We're seeing celebrities and media come out proudly showing their arm that they got vaccinated of all ages. It's a propaganda rollout of this vaccine without informing patients of the potential risks of the vaccine. We would never do that in any other medical procedure. If you go in and have an elective procedure, medical procedure, the doctors are required to have you sign a long informed consent. They're required to tell you about what the benefits are of the procedure and what the risks are. And then you have to physically sign a piece of paper acknowledging that you've been given the risks and benefits and that you've made a decision that you want to move forward with that. That's not required with vaccinations, and it's unfortunate. Imagine this, it's a perfect business model. You make a product, you're immune from all liability from that product, and the government mandates that the customer must purchase your product. And that's exactly what's going on with vaccines in our country. In California, which is where I live, children are not allowed to attend public school unless they've been fully vaccinated against a large vaccine schedule. And I believe coming this fall, when kids go back to school, we're going to see the COVID-19 vaccine added to the mandated requirement. So vaccine companies immune from liability and their customers are mandated. What a business model. I'd like that business model. I don't think it's right. And I think most importantly, the public needs to be informed about that perverse and controversial financial incentive and business model. I just want people to know the truth. I'm not anti-vax. What are the benefits? What are the risks? And you make your own decision and don't be led by propaganda from celebrities telling you what to do.
There are very important points, doctor. We must think about it. Just a personal question, if I can ask you, is what do you personally think about the vaccine? Would you or your family or your peers take it?
No. So I'm not going to be vaccinated, in part because I don't believe that I'm at high risk. I'm healthy. I take supplements. I eat clean. I exercise almost every day. And I'm very, very confident in our ability to treat this virus if I were to get it in the early mild stages. Again, I've treated hundreds of patients, some of which have been very high risk, and I've treated successfully ivermectin, hydroxychloroquine, inhaled budesonide, vitamin D, zinc, quercetin, etc. By the way, on my website, RX for Liberty, I list some of these supplements that I recommend that people take to prepare their immune system. So my family is not getting the vaccination. My mom and dad, they're in their late 80s. They decided to get the vaccination. So they listened to what I had to say, and they were just so fearful, and they were taught to be fearful, and their peer groups, many of them are getting the vaccination. So they went out and got vaccinated. So again, I'm not anti-vax, but it's important that you have informed consent and do a little work and educate yourself. Go to the VAERS website and take a look. Go to Bobby Kennedy Jr.'s website, Children's Health Defense. You can look it up, either his name or Children's Health Defense. And he's got a lot of excellent information about the vaccine and about COVID-19 in general.
Thank you, doctor. So just a last question. If the vaccines are somehow mandated through the corporations, like for example, today we see that if you want to go to the work, you need to wear mask because that's mandatory at work. So
Yeah.
similarly, it started with it's just a mask, it's just a lockdown. Now, if it's just a vaccine and they want everyone to be vaccinated to work, then what is the solution? That what we do?
I think we need to push back. And one of the purposes now of America's frontline doctors is to help people push back. So we're putting people that are being mandated to do these various things or risk losing their job. We're putting them in touch with civil rights attorneys that will help them push back legally against some of these mandates, whether it's airlines or government workers or even the military now is talking about mandating the vaccine for folks that are in the military. So we're doing what we can to help push back against that. And I'm hopeful through the legal system, we'll be able to prevent some of these mandates from coming to be. I think it's wrong, not because I'm against vaccines. I think it's wrong because individuals should be making decisions about their own health, not a government agency, not an employer. In every other aspect of healthcare, we don't allow employers to tell employees what they should do, and we shouldn't allow that in the vaccine or mask industry, if as well. So I'm hoping people stand up and can find legal representation and groups that will support that effort. It's important. This is really an interesting time that we're living in, and I hope tyranny will not take over, and that liberty will still break through, and that our freedoms will be maintained, and that we won't live our life in fear.
Thank you so much, doctor, for spreading the light and fighting for health, freedom, and truth, and joining the show and educating the audience. Thank you so much, doctor. Just a final comments that you want to give to our audience.
Stay strong, stay brave, listen to the truth, spread the truth. Reach out to me if you'd like. You can reach me through my website, rxforliberty.com, and I try to respond to everybody's email within 24 hours. Happy to communicate with you. Look for like-minded groups that are spreading freedom and truth, and don't be afraid. We've got one life to live. Don't live it in fear.
Thank you so much, doctor. It was an amazing interview. Thank you so much.
It's my pleasure. Thank you so much for having me, and hopefully we can do this again soon.
Sure, sir. Thank you so much.
All right. And happy Easter weekend, all of you as well.
You too, sir. Thank you.